Sarah, before we went to the break, we were talking about making tough choices. I came across some information several years ago that said 9 out of 10 people, if told they needed to make a serious life change, that only 10% of people were able to do it.
Yeah.
But I hear you say something that 80% of heart diseases are preventable. How can we raise that 10% up to 80% of people who are changing and making the tough decisions?
One of the things that I love the most about the American Heart Association, it's about realistic changes.
Okay.
We're not asking you if you normally came home relaxed at night after a long day of work and your time was in front of the TV and that's how you relax. We're not asking you to come home, put on your jogging clothes and go out run 5 miles. That is not what it's about. It's about small changes. So if you didn't have any physical activity in your day at all, try to work in 20 minutes. And that's cumulative. Park farther away, walk on your lunch, come back, then you can still have your routine. So it's about making small changes because small changes can last and then you can build on those changes. But small changes can have a huge impact on your heart health.
Now, we're just getting out of the time of year where we do New Year's resolutions. And everyone wants us, I'm going to the gym, I'm going to run 2 or 3 miles.
Right.
So that's very important that you say, do the little things. So many times I see people, their intentions are great.
Yeah.
But their goals are too big and they quit a month later. You miss 1 day at the gym, then you miss 2 days at the gym.
Yep.
But that is simple, practical advice that you're offering. What other tidbits do you have? You said park further away. What other tidbits would you have?
When you are either out eating or when you're eating at home, it's just every meal, it's another decision. You think you make the decision either way. You can just choose whether you want to make it a little healthier.
I made a bad decision last week with my meals.
Did you? You're not alone. I mean, the
Okay.
biggest thing is also moderation. It doesn't mean you can never have a pizza again.
Right.
I love pizza. But the thing is that shouldn't be your nightly meal.
Right.
You look at the sodium, you look at what's available, you look at the vegetables or fruits that you're not getting from that, those calories that you're taking in that are not being helpful to your body. So it's not about being Superman. It's not about being always 100% on. It's about making small, realistic choices. So you go out to lunch with a group of coworkers or with your family, choose baked, don't choose fried.
Right.
Get the dressing on the side.
Absolutely.
Go for the fat-free dressing. You can don't get the fries, get one of the steamed veggies. Like you can make little decisions and every decision makes a big difference on your heart. So we do it to ourselves. We're all guilty of it where you go, I know this is not good for me, but I'm eating that brownie. And you can know that, but as long as you know you're not eating the pan and that you're eating that after you had this nice, healthy meal that made you feel good and was good for your heart. So little, tiny decisions every day, and that's a way to look at it.
Well, let's look at the whole idea of accountability and having partnership. Is that something you recommend? Have someone to talk to and say, this is what I'm doing, or not?
If you've ever tried to lose weight either with coworkers or if you tried to lose weight with your spouse and do it together, it's always easier because then you'll notice when one of if your friend at work falls off, you kind of start to get a little bit more slack about your workout or making sure you work through your lunch instead of getting out and actually, putting on your sneakers and walking around. So it is easier when you bring the people around you to do it together. You can get your kids involved. If you're at home right now and you're watching and you want to get your children involved, instead of before they go, when you go to the movies on Saturday, take them out and say, you know what, put your sneakers on. We're going to go run around the block and I bet I can beat you. And make it fun. And you do it together, and that really has a huge impact. And then it also starts to build healthier lifestyles as a family.
Talk to me a little bit about the Gifford Go Red Women Search. Talk to me about that.
This is actually the second year that we've done this. We are actually trying to find 3 women in our community that'll be the faces of Go Red for Women. And Go Red for Women is all about women and heart disease. So the whole purpose of the search, when we did it last year, was to start a conversation, just like how you're talking here. Right. People don't want to hear about heart disease really from me. They want to hear it from someone who survived it. If there's a heart attack survivor, they want to hear how that they're preventing it now. And we have heart disease survivors, we have heart attack survivors, which is different. And then we also have lifestyle change. So we are looking for one woman who's a heart attack survivor, heart disease survivor, and lifestyle change award. And those women, basically how they can enter or nominate themselves or nominate someone they love. They do a video and they post it on our Facebook site, which
And
is
how many entries do you get?
last year I believe we had 17.
17 entries.
17 entries, and we narrowed it down to 3 women who are absolutely amazing. And throughout the year, they've talked to different audiences. They've shared their story through media. They've been in the parades. We've had them everywhere, and it's just an incredible experience. So they've become very close and been able to start a lot of really important conversations with other women in our community.
Now, how long has this campaign been in place?
Well, this is our second year in doing
Second
it, and
year.
it's something that we only do in Guilford County. So it started here and it's staying here. But nomination period is open now and it's through April 25th. And women can either go to the Facebook page, which is facebook.com/GoRedTriad, and just upload a video of why they would like to nominate themselves or nominate someone they love. Or if they can't do that, they can stop by our AHA offices, which is right in Greensboro, and they can nominate them in person.
Now, how long of a video are we talking about?
It can be
5
very
minutes,
short.
10 minutes, 2
No,
minutes?
it can be very short. I had some that were about 5-6 minutes, and I had some that were 30 seconds. So it's really about how much you want to share about this person or about yourself and your story. And what we do this year, which is really exciting, is by May 1st, we are choosing 2 finalists for each category. And then according to the Facebook likes on the videos or the photos, those will be the women that will be chosen as the Guilford Go Red Women of 2012.
Right. Now, talk to me about the expo. How does that relate to this campaign, to that
Sure.
program?
We're very excited because it's our inaugural year of the Guilford Go Red for Women Luncheon and Expo, and it's actually held in Corey Convention Center on May 15th. That is when we are going to be announcing the winners. So it's very exciting. There's also an opportunity for women. The luncheon is normally $100 to partake in. Includes expos and yoga and Zumba and all sorts of fun things throughout the morning, and then the lunch. So it's a big educational expo as well. But it's normally $100 to attend. And we want to make sure that it's open to all women. So we actually have, courtesy of our Circle of Red donors, they're actually sponsoring Make It Your Mission scholarship seats. So
Right.
if women would like to come but can't afford the entry fee to come, they can go to our heart.org website.
Right.
And they can go ahead and put in a nomination to try and have a scholarship seat.
Now, I want to go back to something that you mentioned earlier. You talked about ethnicity, something that we can't change. When we look at African Americans, we look at Caucasians,
Yep.
we look at people of Hispanic descent. What are the differences that you're seeing
Yep.
when we look at these different groups? Who's most at risk?
Yep. There are a couple of different things. Actually, African Americans and Hispanics have a greater risk
Okay.
of heart disease. Then there's also an increased risk among Asians and Native Americans, which we've just recently more found out research about the Native American increased risk factor. But there's also the issue of awareness. With, if you're looking specifically at women, about 60% of Caucasian women would assume or have known in research studies that heart disease is their #1 health threat. When you go to African American women, it's 44%. When you go to Hispanic women, it's 43%. So there's information and there's issues that we have to deal with around awareness. Because once again, if you don't know what those warning signs are, you don't know if that's your greatest health threat, you're not going to be aware. You're going to think, oh, I'm just not feeling well today, or I just don't feel like myself, or, I think I'll just go back to bed for a little bit and I'll be fine. You don't have that in the back of your head going, maybe this is something more.
Well, share with me some of the tactics that you're using to increase awareness. I know there's probably pamphlets and different things
Yeah.
going out, but what are you guys doing here in 2012 to increase that awareness?
We're really trying to reach out more to some different faith-based communities, reach out to populations that we have not typically been in front of. That's one reason why with the Guilford Go Red Luncheon and Expo, we want those scholarship seats. If you are not, if you don't have to be in that bracket where you can afford to pay that, we want to make sure that, we're still coming out. We want to have a true vision of who heart disease impacts. And that is multi-ethnic. That is not just Caucasian women, because we know it's an issue. That is, we need, the women from our churches, we need the women from our community leaders. We need them out there in that room to hear what the warning signs are, and then to take that back to their congregations. to take that back to our universities. We've had a great partnership with NCA&T that we're really excited about. They're actually having a whole Aggies Go Red Day on the 13th. So it's really exciting about different ways that we can reach out to the community and make that really a true representation.
So you're talking about the community. Let me ask you this question. What about volunteerism? Can the community, those that are watching the program now, they say, I want to help, I want to get involved. How would they go about doing that?
The American Heart Association runs on volunteers.
Okay.
So we are the largest volunteer organization for health in the United States. So from 1924, from high-end volunteers of volunteers that are participating on national or international boards, down to being out at the mall with us to help us spread awareness and give out fun prizes around Go Red for Women or red dress pins. We need help from the whole gamut. So if you're interested in helping out with volunteering for the American Heart Association or for Go Red for Women, we would love your help. They can just actually reach out to us through our website or through the phone number.
Right. And your overarching message that you would like to get out, what is that?
That heart disease is the #1 killer of both men and women. And when you look at women, we lose 1 in every 3 to heart disease. And that 80% preventable is something that I hope lives in people's minds that watch this, because those decisions that you make really do have a huge impact. My other message would be listen to your body. When it's something that is not how you normally respond, if you're so much more fatigued than you ever normally are, if you have a back pain or an arm pain that has not gone away and was not because you helped someone move, you need to take note of that and realize that, it could be my heart.
So many times things seem so overwhelming.
Yes.
What can we do? But that's the best news I've heard all day, is that 80% of it is preventable if we make simple life changes.
Exactly.
Well, once again, I've enjoyed you coming and sharing with us today. For Public Report, this is John Lemon. We'll see you next time.
This has been Public Report. Public Report discusses the issues of interest and importance to our viewing area. Please remember that the views expressed by our guests are their own and do not necessarily represent the views of TCT or the station.